Every step a healthy person takes relies on two invisible defense systems. Pain acts as an immediate early warning alarm, while blood flow functions as an automatic repair crew, rushing nutrients to heal minor injuries before they can escalate. For those with diabetes, long-term high blood sugar systematically dismantles both of these protections in the lower legs and feet, creating a dangerous biological deficit. High blood sugar can damage the nerves then. When these pathways begin short-circuiting, the foot goes numb. A person can step on a sharp object or wear shoes that are far too tight without ever hearing the body's internal alarm. At the same time, the blood vessels themselves begin narrowing. This physical blockage chokes off the delivery of red blood cells, leaving the repair crew unable to reach even a simple scratch. This combination turns a minor, unfelt injury into a ticking clock. Because the damage isn't felt, it continues to worsen. And because it isn't fed by blood flow, it cannot heal. Without these internal defenses, the foot enters a predictable timeline of breakdown. It starts with a microscopic scrape, an injury that often occurs without the person even knowing it happened. Because there is no pain to signal a change in movement, the patient continues to walk on the injury. The repetitive pressure forces the skin to break open, forming a shallow wound called an ulcer. Under normal conditions, the body would close this gap in days. But without adequate blood flow, the ulcer can remain open for months, leaving the underlying tissue exposed to the environment. This cross-section shows the deterioration. Without blood flow to carry the immune response, bacteria pool into the opening and multiply. The infection descends, anchoring directly to the bone. If blood supply stops, tissue dies, turning from pink to dead gray, a state called gangrene. When the internal alarm is silent and the repair crew is blocked, a single scratch can lead to total tissue destruction. Clinical care focuses on manually performing the defensive jobs the body can no longer do. Doctors use specific treatments to substitute for these lost biological functions. Since the patient can't feel the injury, doctors use custom boots or casts to keep all weight off the foot. This offloading acts as a physical substitute for the missing pain alarm. To assist the repair process, a doctor will manually remove dead or infected skin. This cleaning process creates the physical space necessary for new, healthy cells to grow. Antibiotics are introduced as a chemical substitute for the weakened immune system, working to stop the bacteria from spreading deeper into the body. In some cases, doctors perform vascular procedures to mechanically clear blocked vessels, attempting to restart the natural delivery of oxygen and nutrients. Surgery becomes necessary when these manual substitutions can no longer contain the damage. If an infection reaches the bone and threatens to enter the bloodstream, it poses a risk to the patient's life. When gangrene sets in and blood flow is gone, the dead tissue becomes a permanent breeding ground for bacteria. As shown here, a minor amputation may involve removing a single toe, while a major amputation removes the leg below or above the knee. Removing non-viable tissue creates a hard stop against the spread of infection. This boundary isolates the damage, preventing a localized wound from turning into a systemic, life-threatening crisis. While these medical interventions are critical, they are often avoidable. Protecting your mobility starts with taking over the roles your body can no longer perform. Because your nervous system won't alert you to a cut or a blister, you must manually become your own alarm system. The most effective defense is a daily visual inspection. By checking your feet every morning for redness or small breaks in the skin, you catch injuries while they are still in the microscopic stage. You can prevent these injuries by wearing protective shoes at all times, even indoors. This creates a physical barrier that stops the cycle of damage before it starts. At the same time, managing blood sugar levels addresses the root cause, protecting the health of the nerves and blood vessels that remain. By replacing internal signals with vigilant daily habits, you have the power to halt the progression of diabetic foot disease and preserve your long-term health.